So like a medical student, you can have many different opportunities to go into many different fields. So the first field that you could go into is social worker. Social workers, um, well, the quote basically defines it as a social worker. You advocate for the others, be the young, the old. You work with clients from every station in life, and sometimes dire economic backdrops to ease them through the transitions and hardships and mental tough times. Social workers are basically best known as the people who help bring children out of nasty homes and place them into either foster homes or adoption or orphanages, and that is basically what social workers are best known for. Um, there are different. There are two different types of social workers. There's a direct social worker and the clinical social worker. The direct social worker basically does the direct field work and everything. They physically interact with the clients. Sometimes go out into the field, into their homes. Um, uh, while social workers, clinical social workers, will basically do more of a psychologist job, while they'll diagnose the behaviors of a social of a person, a client. Sometimes they can have mental disorders. Sometimes they need treatment plans, and they'll work with actual doctors, perhaps a medical doctor, perhaps a psychologist, perhaps psychiatrist. Yeah, and so that is what a clinical social worker and the difference between a clinical and a direct social worker. Um, and like I said, direct social workers, they do help. They're more hands-on in the whole more field work. Um, Direct social workers do need bachelor's degrees. Sometimes they can do associate's degrees. UNC Pembroke actually is their psychology field does offer social work, work option, and then they also have a master's level social work. They do get more direct social workers do get more supervised field work, and they can be caseworkers or assistants. While clinical social workers need to have a master's degree, and they can have to be licensed, and they have to have 3,000 hours of a supervised clinical experience after graduating with your master's. Um, then there's another type of psychology that you can go into, which is the clinical psychologist, which is what I'm interested in. Clinical psychologists are basically the people you think of, that you sit on the chair or the couch and you talk about your feelings. But that is not true. That is not really what happens in a clinical. That can happen in a clinical psychology environment. However, they have many more responsibilities. They can be marriage counselors. They can work with the military personnel. They can be mental health counselors. They can work in mental asylums. They can work in prisons. Clinical psychologists are responsible for many things. They do have to have a doctorate or master's degree. They are not allowed to write medication or prescriptions. That is not their job. That is a psychiatrist, and psychiatrists are medical for students. They do work, however, with psychiatrists. Clinical psychologists can work in a hospital, and so they work with the medical. They more work with the mental patients, with the nurses and the doctors, and they say, oh, well, we have this patient that is a little bit might have a disorder. So the clinical psychologist will come in and talk to about what is happening. I have that on the whole time. They will talk and possibly diagnose or try to help these clinical psychologists. To help the nurses and help calm them down, or help them understand what is happening with with their patients. The clinical psychologist has to be licensed by the state boards, basically like any other person that has a that's trying to work as a therapist, or nurse has to be licensed, or a doctor has to be licensed. The psychologist does have to be licensed. Typically, they can go through residencies, or not residencies, or internships. And an internship is just possibly going to work for your university, helping with people with mental disorders or possibly going to work at rape or trauma centers and everything. It's many different variety of things for internships or just for psychology students. The field is has a very big variety, and the fact that people don't believe that we do is not true, because honestly, you can do pretty much anything with a psychology degree, and even join the military. The military does have options to. The U.S. Army has a psychology interpreter field. I don't exactly know what it was, but I saw it, and so you can go into the military. The military, when you have a graduate degree, you can do aerospace psychology, you can do clinical psychology. I know the U.S. Navy, they have the aerospace psychology, and you can work on the Navy ships with the military. And you can work as you can either work as a civilian for the military or as a actual military personnel, and you can be recruited by the military for working as a psychologist. But psychology does have it isn't a narrow field like some people imagine it to be. It actually does have a very variety of things that you can do with it. People don't think you can, but that's a fact that psychology is helpful in studying the fact that, or at least understanding that humans are far more complex than just what science or basic science can show you. It shows you that there is so much more to humans and their mind and how things can affect them, mental disorders, things that are beyond their capabilities of truly understanding. And that is why I personally like psychology, is because it will open your mind to being more understanding of the fact that humans are so much more complex than what they let them, or what science or basic science can prove it to be. And that is why I personally like psychology. But it's honestly an interesting field in my point of view. You do have to put some work into it to get really good jobs. The field itself, for salary rise, it can range from $30,000 to possibly, if you were really the military itself pays somewhere around $200,000 for their clinical psychologists, and that's just a civilian clinical psychologist. Clinical social workers only at the end. Direct social workers at their end of their years or in the middle of their years get more around $70,000, but at their beginning, both for direct and clinical social workers, they can get $30,000 as a start pay. But it can be true for all psychology fields. So you might get $30,000 for the start pay, but by the end of it, you might have somewhere around $70,000 to $200,000. Psychology, honestly, is a great field, and that is full of a variety of work environments, from the U.S. naval ship to possibly a care facility or a hospital, or possibly your own office, from being your own personal clinical psychologist that you work for yourself. Psychology is honestly a great field, and that is why I chose it, because it has a variety of options.